So dear students, we'll just discuss a on-table operative finding, which is very common entity uh, all over the country and worldwide. Just see what is this on-table finding. See that you can see the diaphragm here, you can see the liver here, you can see the momentum here, you can see the black colored one. This is gangrenous gallbladder. You can see that gangrenous gallbladder. So it's a pruritic gallbladder. Gallbladder wall is necrosed because of the infective thrombosis of the cystic artery. So entire wall is black with the mucosal necrosis, probably due to gallstones with acute presentation with suppuration. Patient often with sepsis, and these things are common in diabetic patients with other comorbid status, and naturally LFT may be altered. You have to do a CT scan and confirm CBD is okay, because stone in the CBD, if you do laparoscopic cholecystectomy and without removal of the CBD stone, you will have a leak. So first you have to do a endoscopic retrograde cholangiopancreatography, that's a ERCP. Then retrieve the stone from the CBD, put a stent. Then usually now currently within 24 to 48 hours, you go in and do a laparoscopic cholecystectomy. Of course, always take the consent for open in such situation, because there will be adhesions, there will be sepsis, there will be sometimes may not be able to remove the gallbladder from the liver bed, most important, may not be able to identify the calyx and dissect the calyx, because everything will plaster, common bile duct, cystic artery, cystic duct, and Hartmann pouch. Everything will be plastered. Won't be able to create a plane, and won't be able to identify CBD and cystic duct separate. The critical view of the safety you will not be able to get. And such a situation, instead of doing adventure and injuring the common bile duct or CBD, you better to convert into open cholecystectomy safely and do the formal procedure. But remember, most of the time, current laparoscopy surgeons or general surgeons who are well trained now for laparoscopy, with careful dissection, they will be able to remove the gallbladder through the laparoscopy without any hurt. But when the surgeon feels it is not possible and difficult while dissecting through laparoscopy, don't be hesitant to convert to open and do a formal, safer procedure. Safety comes first. So ego is a lesser. That is the point where I want to highlight such a patient. That is about gangrenous gallbladder. You have to control sepsis. Antibiotic is important. You may have to put a drain in this patient. So all those things. Conversion option also I have to keep. That's why this entity is important. So all those things I have told. Infective cystic artery, common in diabetic, elderly, immunosuppressor. See the mucosa here, necrosed, entire mucosa is necrosed. Stones are there, multiple pigmented stones here, see. Multiple pigmented stones are there, see. See the necrosed mucosa here, see that? Pus here, infected bile actually. So that is the typical of the gangrenous gallbladder. So evaluation, I said hematocrit, CCT is important to look at the CBD, creatinine, blood sugar, antibiotic therapy, resuscitation. Then ERCP is required if you are suspected for CBD. Then laparoscopic cholecystectomy, take consent for open. That's very important. Remember. So answer the MCQ. Murphy sign is A, B, C, D. Find out the right answer. Put it in the comment box, students. I will acknowledge your answer actually. Give the right answer later. So please go through the MCQ and give the right answer. Another MCQ, Tokyo consensus guidelines for severity grading of acute cholecystitis grade 2 is A, B, C, D. Go through this one. Click the right answer. It is an MCQ question asked in different national level exams like NEET. So Tokyo level gradings you should know to answer these such questions very clearly. So go through it, memorize and put right answer in the comment box. I will give the right answer later. I acknowledge your answer. So please subscribe my channel, SRB Surgical Insight, for daily lectures, and also increase your surgical knowledge with the live sessions also, with daily lectures also. So please answer the MCQ, that's important thing. And quotation of the day: humility, simplicity, kindness, gentleness, 4 qualities keep you always happy. And this is the most important. When you are like that, others to appreciably surprise. So you are so nice. How it is possible? It's impossible. So they will surprise about your these important four qualities, especially for a surgeon and also as a human being. Students, please go through my SRB's Manual of Surgery, very popular book all over the world, and my Clinical Methods in Surgery with the video lectures supersedes all other clinical book with the proper information. Everything is covered with the videos, instruments, specimens, basic orthopedic, and also operative surgery briefly. So everything for the clinical side, for CBME syllabus or practical point, it is very, very useful. And my operative surgery, Atlas of Tissue Approximation are very popular books. And please subscribe my website, YouTube, Instagram website for further knowledge and daily regular knowledge. And my digital lectures are there for 220 hours through JP Publishers. For 1 year, you can always purchase and have increase your surgical knowledge, because everything is covered, including your specialties, original surgery, gastro surgeries, basic operations, instruments, everything as per CBME syllabus for UGs and also for PGs, basic information, it gives everything. Our lecture for 220 coverage is very, very useful for you. Please, you can purchase through JP Publishers. So please subscribe again requesting my YouTube channel, which is free, SRB Surgical Insight. QR code is here. So students, I hope you have understood the lecture very well. That is gallbladder, gangrenous gallbladder. Please go through my book to have in detail about the cholecystitis, acute, chronic, and entire thing about the gallbladder, laparoscopic cholecystectomy, and different other diseases related to the gallbladder carcinoma, gallbladder stones, CBD stones. So go through the gallbladder chapter for a detailed understanding of the subject. So thank you so much.